Here we see one of the risk factors for using antibiotic therapy. It's called a Candida infection. Candida infections have been well known as a generally accepted major risk factor for patients taking antibiotics. That infection can go systemic. That means it goes from a local place to going throughout the entire body. Well, this is what it does in your intestines, where the infection starts. On the left side is a representation of what a normal, healthy intestine should look like. As we move to the right, the black spots are inflammatory infiltration going inside of your intestinal walls. It starts to make changes in the intestinal walls as it moves farther to the right, to the point where the pieces that go up are called microvilli. They completely disappear as the wall thickens and the wall becomes completely infiltrated with inflammatory byproducts, giving you a leaky gut. On top of that, the Candida infection looks like this. This is an endoscopy picture looking through an intestine. All the white spots are infection of Candida. If we look at a microscope slide, it looks like this. A healthy intestinal wall on the left side, a chronically inflamed intestinal wall on the right side. Notice how much thicker the wall is, and that all the microvilli, the pieces that come up, are not looking healthy at best. Well, something that happens with Candida is it has typically 3 stages or 3 different forms within us. It can be 4. Those stages are Candida, which is a yeast. It can turn into mold. It commonly turns into a fungus, and it can go into fungal parasite. These soft, feathery looking hairs that come off this piece of fungus are called mycelia. Mycelia have a coating on them called chitin. Chitin blocks the ability of your immune system to begin to attack the fungal infection. Chitin is the same thing that makes up the shells on beetles like the one shown in here, or other bugs that makes them crunchy. So this is like you have bugs crawling around inside of your intestine and into the intestinal wall and throughout your body. The chitin blocks your immune system from being able to attack it. This creates an abnormal ability for your intestines to absorb right, so it starts creating what's called a leaky gut. That begins to overwhelm the liver. The reason it does this is all the blood supply that returns from your entire gut goes directly into your liver. Your liver has a few jobs to do. It's supposed to catch and destroy bacteria and pathogens that come out of your gut, store your food sources, make sugar from protein when you're stressed, clear your body of toxins, and make bile. Well, it does that by a cytochrome P450 system. That's how it detoxifies all the toxins that come into your body. The cytochrome P450 also exists inside the intestinal walls. In fact, not only does it detoxify chemicals, but it's also what we use to absorb our nutrients. The problem with too many toxins is it creates such an irritation in the intestinal wall that it begins to explode it and make lesions like this. This makes the leaky gut even worse. We add on top of that a Candida infection, and you can see why you start to get so sick. Then we look further. The leaky gut causes a leaky brain. The same things that irritate the gut wall to make it leak start to make the brain leak also. The brain isn't supposed to leak. When it does, you can't think very well, and it predisposes it to toxins and infections to get inside of your brain. This happens through what's called LPS. Those are the cell walls of the pathogenic bacteria that are inside of the gut, typically because of antibiotic therapies. It creates an autoimmune reaction that starts to go through the entire body. This is called a tight junction right here. These are supposed to only allow certain things to go through, but when the gut wall is irritated, these open up and allow anything to go through. It goes through the liver, gets overwhelmed. The liver can't process the toxins, and the toxins are what caused the Herxheimer reaction. People commonly believe this is from a reinfection. That's not what the dictionary says. The dictionary says it's a reaction to endotoxins. Those are the toxins from dying bacteria and things breaking, typically from inside of your gut. Another problem that happens with a leaky gut is it starts to create too many toxins within the brain, and it creates a food allergy throughout the entire body. That food allergy can start to localize inside the brain, and it can be the basis for psychological changes. So, a common way to try and address this is to use antifungal agents, which are known to be very toxic to your liver. In fact, they've known this for decades, but continue to use them. We add on top of all of this Western style diets that increase the toxin levels within our body. And you see how the liver can be completely overwhelmed. So we have these problems to overcome. These are what keeps you sick. 40% of the studies that your care is based on, at a minimum, are false, up to 70% in the U.S. The experts are completely unprepared in their education. The lab tests are inadequate at best. The treatment can make you worse, giving you Candida and other pathogens, creating a leaky gut, toxicity, which overloads the liver, gives you food allergies, a leaky brain, psychological changes, and autoimmune responses. Contrast that with natural products. They decrease the Herxheimer reaction. They inhibit the growth of organisms that will make biofilms, and they don't let the biofilms stick. Natural products benefit multiple organs and organ systems. Here's a study of some of the most pathogenic things that we find in our body, bacteria and yeast. Starting from the left side on the column is how many of those organisms are present, and within 7 days they're all gone with the use of natural products. These two products have been found to be equal to one of the strongest antibiotics known. And we know from the studies that the autoimmune process can be arrested and reversed by healing up the gut wall. So we have a choice with all of this. We can continue to do what's not working, or you can try and do it yourself. But to do it yourself, you need to understand Lyme bacteria, co-infections, gut injury and infection, leaky gut, toxicity, how that overloads the liver, your immune response to that, a leaky brain, food allergies, and autoimmunity issues. Or you can trust someone who's worked with this for well over 20 years. Remember, it's insanity to do the same thing over and over and expect different results. On top of all of this, if we look at Poliquin's work, you can look at a person and you can tell what kind of hormonal dysfunctions they have just from their body shape. Each different hormonal dysfunction creating a different body shape may necessitate a completely different approach to the care when you're sick. This is especially the case with Lyme disease. Remember, it ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. Here's how we approach this. We do a functional evaluation. We use diagnostic questionnaires because there's 95% as accurate as lab tests. We do functional lab testing trying to find out how your body's working, not trying to find a disease. We evaluate every body system. We evaluate basic food allergies, Lyme bacteria, and the co-infections with their toxins. We use muscle testing, which research shows to be 95% accurate for a fair amount of this work, and our testing method gives us the very treatment. It confirms the treatment that you need specifically for you, which can be very different from whoever else you know that have the same problem. So you have your choice. You continue what's not working, do it yourself, and try and understand, seek out as much as you can find on Lyme bacteria, the co-infections, gut injury and infections, leaky gut toxicity, liver toxicity, autoimmunity, food allergies, and a leaky brain, and understand it's always changing, or you can trust someone who's been working with us for over 20 years. Here's the value of what we do. The best lab tests we can get are from IGeneX. We look at the total of all the tests with a Lyme panel, co-infection, 2 co-infections that aren't listed in there of Rickettsia and Ehrlichia totaling over $1,500, food allergy testing being a minimum of $550. That's over $2,000 plus exam fees. That doesn't include doctor fees and whether in-house labs he's going to use. Here's our charge. For Lyme exam, it includes a health assessment, basic food allergies, Lyme and co-infections with their toxins, and our lab work, all for a mere $450. For those who respond soon, they can have it at this rate right here, and we will put on our lab fee, which is $65 for free. You can contact us through here, or you can do it through one of our links.